Summary. Caregiver of someone who is mentally ill has a lot of responsibility and stress placed upon them. It is important that they are equipped to look after their mentally ill friend or family member as well as themselves. This means maintaining a healthy diet, regular exercise, adequate sleep, and time for leisure and relaxation. Often a caregiver requires a break from that person they are caring for, and there are organisations which can provide this respite. Action I can take now. Look after yourself physically and mentally. Without doing this, you cannot properly look after someone else. If you need assistance with your situation, e.g. material aid or respite from the person you are caring for, there are organisations that you can contact. Young Carers Program. Young carers are people up to 25 years of age who care in families where someone has an illness, a disability, a mental health issue, or has an alcohol or other drug problem. This program aims to raise awareness of young carers. It also aims to assist young carers to find information about the caring role. Eat well. When you eat, make sure you eat well. The diabetic and heart websites are great sites for healthy recipes. They're usually tasty, quick and simple. If one of your passions is cooking, this kills two birds with one stone, as you also relax while you cook. The fabulous book, Recipes for Life, by Gabrielle Gattei and Dr. Rob Moody, also has fabulous articles such as Playing Mind Games, Finding Hope and Meaning, and Finding Your Own Special Place. Do something just for you. You need to exercise and eat well because you need to be fit to survive. It is just as important to look after yourself emotionally and mentally. As a caregiver, there may be no one else there to ensure you do this for yourself, so be careful. Although sleep is very important, it's a good idea never to sleep without giving yourself a reward for a hard day's work. This may be as simple as lying in bed and listening to your iPod, watching a really diverting film, television program, or reading a book. We're all different, but we all need to slow down our racing mind by immersing it in something that enables us to relax before we sleep. Friendships and caregivers. What has been hard for many young caregivers is that some aspects of friendships can be tricky. Most young caregivers aren't too keen to tell their friends that there is anything mentally wrong with a member of their family. Physical problems are easier to be honest about. Many young people think that admitting that there is something wrong with their loved one is admitting to being a failure in life. This, of course, is not at all true. Having a mentally ill family member can sometimes make young caregivers feel different, alone, and sometimes down and discouraged. Families where parents have a mental illness are sometimes some of the poorest people in our community if the parent is too ill to work. This can be an added stress if you're a young caregiver. Sometimes you may be distracted, exhausted, or a little unresponsive, and your friends may struggle to understand the reasons why. This may even have a negative impact on your grades at school. It may be a good idea to keep in touch with your school counsellor and allow them to build some additional supports around you to help lighten your load. When the person you're caring for is on antidepressants and or other medication. Your family member may be prescribed a medication. It can be very useful to understand what side effects might impact them. Apart from anything else, if this person has an unpleasant side effect, you may bear the brunt of it. The last thing you need is for things to be even more difficult for you. If the side effects of medication are making a family member more difficult to live with, or they behave in an unusual or exaggerated way, you should seek medical advice immediately. Public hospitals have a psychiatric triage system for emergencies. Some young caregivers feel that it is up to them to make sure that their family members do not suffer too much from the social isolation that their illness can cause. There are many support groups and rehabilitation services in this website for families, unwell people, and carers. Material aid. If the person in your family can't work because they are too unwell, your family may be suffering financial hardship. Being a caregiver or having a mental illness can leave us at some of the most impoverished people in the community. If you are desperate, we have listed where you can get help with food, accommodation, bedding, heating, electrical goods, education, food, and other services. Refer to the material aid section. Being a caregiver is a huge role involving a huge investment of time, creativity, and skill. Support for young carers. The Wesley Mission recently reported that carers of the mentally ill are more likely to have health and financial concerns than others in our community. Mental illness can take a significant toll on caregivers and their careers and schooling and their ability to cope financially. The Wesley Mission also reports that an increasing number of mental health carers are now less than 16 years of age. 90% of the carers of the mentally ill are suffering hardship or ill health themselves. This is generally because they are not well supported and not pointed in the right direction to the support groups and agencies that are out there and who have resources that can help. Depression and anxiety are not choices, and it can happen to anyone. In fact, roughly 1 in 5 people will suffer from a mental illness of some kind. Surviving caregiving. Being a young caregiver is a huge challenge for any young person. Stress and depression can often be interrelated. Caring can be exhausting and raise a young person's stress levels. And when stress levels increase, coping mechanisms can be challenged. Caregiving can be a risk factor that may lead to depression and various other health complications. It is therefore important to manage your stress as best you can by paying attention to your diet, keep it healthy and balanced, sleep, make sure it's regular, along with exercise and a good social life. It's also worth considering postponing stressful events if you feel you're at risk of not coping. Life balance. If you are aware that you're struggling with the demands of your caregiving role, try to achieve a life balance and find time to do things you enjoy and that relax you. This can be very difficult, but if you don't, you may just fall in a heap unless you're very strict with yourself and make sure you do some rewarding activities. Having someone to assist you with respite care is a good place to start. This is where it is a good idea to have the person you are caring for involved in some activities away from the home, if at all possible.